Good afternoon. Today is May 10th, and today I'll continue to talk about the coronavirus. So the first piece of news that I'd like to talk about is that airlines are facing a terrible present, but it will probably face an even more bleak future. So major airlines in the United States have dramatically slashed schedules as air travel is literally shut down by the coronavirus, and the airlines are now bleeding money. Airlines are now bleeding money and dropping airports from its networks. So, for example, Delta and other major airlines in the United States are losing $350 million to $400 million a day, as expenses like payroll, rent, and aircraft maintenance far exceed the money they bring. So passenger traffic is about down 94%, and half of the industry's planes are just parked at major airports and desert airstrips. So right now we can already see the terrible present it has now, but for the future it's probably going to get even worse. If there's no vaccine, it may be months, if not years, before our airlines operate. And honestly, I think this current crisis could push many airlines into bankruptcy or just completely break down. And I don't know what's going to happen to all those employees. They have millions, if not hundreds of thousands of employees, and the airlines are just bleeding money. So it's just down to if the airline can survive this, and I really hope they do, but money is bleeding almost every day, as we can see. The second thing that I like to talk about is that medical bias may add to the outsized impact of the COVID-19 on African Americans. So African Americans are hit at a high rate in which the COVID-19 is killing them compared to other races, and black families are now wondering whether racial bias may have played a role. Decades of research have shown that black patients in the United States receive inferior medical care compared with white patients. And African Americans also enter the healthcare system with distinct disadvantages, such as less access to quality healthcare in many black communities, and they're more likely to have diabetes, hypertension, or other underlying conditions. So the CDC has recently advised healthcare professionals to be careful not to let bias influence their treatment during the pandemic. And I think that America, the racial bias is a large problem, and I'm pretty sure it is happening around the country. So at this point, I think that I can recommend is that to seek help as soon as possible, and if you feel you're sick, and persist. Don't just be turned down by perhaps one hospital. Persist if you feel like you're being unfairly treated. The third thing that I like to talk about is that before coronavirus cases hit hard, paramedics would respond to calls of patients whose heart has stopped by beginning chest compressions, administering epinephrine, or using the defibrillator to shock the heart back to life, or resuscitation. And this would have done even though studies have found that 1 to 3% of people found in such condition can be resuscitated. So emergency workers are going to make every possible effort to save every life. But as the coronavirus hits and a larger number of paramedics are sickened by the virus, emergency units have changed their practices to limit their exposure. And I personally think the most unsettling change is the decision to suspend or limit resuscitation in cases where the odds of survival are near zero. And I feel like this is just medicine as we have never done before, because there are some ethical dilemmas which I think paramedics have to face, of like to resuscitate and save one life, or risk the lives of everybody in the emergency room or car. So these are really tough decisions, and I feel like hospitals wouldn't be making these decisions if they do not have a full grasp on it. And personally, I think that it just kind of like, if the patient is extremely likely to have no chance, then I feel like they should care about their own safety to save more lives in the future. That's it. Thank you for listening, and have a good day. Thank you.